Ready? We'll start it off. So I just want to start off by thanking everybody here for attending our back pain and sciatica workshop. Dr. Emily and myself are really appreciative you guys take time out of your busy day to join us. Today we're going to be talking about back pain and sciatica. So just a little bit of housekeeping to start. Some things, if you guys aren't familiar with how to use Zoom, we're just going to ask you all to keep yourself muted throughout the meeting. And if you can see on the bottom left-hand side of the screen, there's a little tab there where you can hover over, and it gives you the option to kind of either close down your video or close down your, or mute yourself. So just make sure that you're muted throughout. And at the end, we'll chime in for Q&A. You can certainly take an opportunity then to chime in. Also, there's a comment box on the bottom as well, which you can then put comments in or chat through to, if you have any questions or comments, or as we're going throughout, we may ask some questions of you guys. So certainly feel free to put your comments in the chat box. Excuse me, let me go back there. What else? So just really importantly, I mean, our goal is really just give you guys a quick overview of what back pain and sciatica is and give you some tangible things that you can take away with you today to start working on your own at home. So we hope you guys enjoy this, and we hope you will have an opportunity in the future to do more of these with you. So let's get started. Anything that I've missed, Dr. Emily?
No, I think the only thing is if we get kicked off today on Zoom, you can just sign right back in on the same link, and you should be right back into the presentation.
Definitely, for sure. So let's get started here. So to start off with our agenda, so we're going to first talking about what is sciatica and who's at risk. What common symptoms you may see or feel, what the causes it, and then ultimately how to get rid of it.
And so today we really just want to make this an interactive workshop. We really want to personalize it to each of you, especially because you're taking time out of your day to meet with us. So please feel free during either this time or throughout the presentation to go ahead in the chat box and let us know why you're here today. Maybe you're experiencing back pain and sciatic pain, or you have in the past. So maybe if you're comfortable being a little bit more descriptive in that, then we can really gear questions specifically to each and every one of you as we go through.
Definitely. So let's just take a moment to kind of reintroduce ourselves. My name is Dr. Ken Corcoran. I'm a doctor of physical therapy, board certified sports clinical specialist, and certified ergonomic assessment specialist. I'm also trained in multiple manual therapy techniques, including ART, which stands for active release technique, Graston, as well as dry needling. I'm also the founder, CEO of Activate Health, which we provide concierge, mobile, PT, and wellness services. So in addition to providing that personalized one-on-one approach, it's also a convenience factor. We come to you, to your home, your office, to make it a little bit more easy and achievable. Also in this current state, we also offer telehealth, which some of you guys may not be familiar with telehealth. I think Dr. Emily and myself, it's quite a common buzzword thrown around right now. So basically what that means is that through similar platforms as Zoom, we'll have an opportunity to kind of chat with you and discuss what your issues are and give you some advice and guidance.
All right, so I am Dr. Emily Rausch. I'm also a doctor of physical therapy like Dr. Ken, and I have advanced training in vestibular therapy, which is vertigo and dizziness, concussions, as well as pelvic floor training. So that would be anything that you might experience like urinary incontinence, pelvic pain, prolapse. I'm the founder and CEO of Trinity Therapy and Wellness based here in Charlotte. And just like Dr. Ken, I'm a concierge mobile PT. So making it convenient and private for you to come to you in your own home. And as well during this time offering virtual sessions for your safety.
All right, so to get in, what is sciatica? I think oftentimes we associate sciatica with the symptoms. Commonly that'd be burning pain or pain in the back of the leg, starting at the hip and running down the leg. Ultimately, sciatica is coming from the sciatic nerve. So what is the sciatic nerve? Well, the sciatic nerve is actually the largest nerve in the body. As you can see in the picture on the right-hand side here, we have several nerves from the lower back that are branching off, coming together to form that sciatic nerve as it passes down the back of the hip. And then that nerve actually travels all the way down the leg and into the foot. So if you're having symptoms down the back of the leg and the foot, this picture might help give you a little bit better imagery as far as why that is and why you're having that distribution of pain.
So big question is, who's at risk and are you one of these people? So when Dr. Ken just talked about where that nerve runs, right, it stems at the low back. So really think about occupations or activities that would put strain or stress to this area. So anyone who's doing physical labor, like construction, working, any kind of person that's doing physical labor with kids, maybe you're a mom, an athlete, maybe you're a teacher. Also think about prolonged positioning. People who are at a desk all day or sit all day driving something, retail workers who are standing, or teachers who are standing all day. And again, just those people who might be just doing daily activities that are putting stress on that low back. So really, who's at risk is kind of everyone, right? It's actually one of the leading causes of disability. About 80% of the population will experience low back pain. It's one of the top 6 reasons people complain to their doctor when they go in. So our hope today is just that you see how prevalent this is, and then hopefully walk away with something that you can do about it.
For sure. So you're not alone when you're dealing with back pain or sciatica, that's for sure. All right, so getting in some common symptoms. I think commonly we think about that aching in the back, right? Also sharp shooting or radiating pain that may be going down the leg, or experiencing some tingling numbness in the foot, or just weakness. And that may be commonly noticed as just heaviness in the leg. So you're having difficulty kind of lifting that leg up and moving that leg as you're walking through that. I think it's important, as we know down here on the bottom, to pay attention to the location, the duration, and the frequency. Those are great things that you can then report to your healthcare provider to give us a better understanding as far as what's going on in your situation, in your case, and allow us to ultimately give you a better diagnosis and to better treat you. All right, so getting into some common limitations. Excuse me. So obviously forward bending, if you've ever been bending down, putting on your shoes, you're having some pain or difficulty lifting, whether it be light or heavy lifting, prolonged standing and walking. I commonly have patients that come into the clinic telling me after 10, 20 minutes they're having limitations standing, where they need to now sit down and take a break, or prolonged sitting, traveling. If you're sitting in your car for a long period of time, especially here in the Charlotte area during rush hour, you can be stuck in your car for a minimum of an hour. So if you're sitting for an extended period of time, that can certainly be flaring up some of your symptoms. Also running, causing a lot of compressive loads on your back. I work with a lot of runners. So doing long distance running, they're getting a lot of that repetitive, constant compressive load to the back. And then lastly, sex, and then bowel movements, which Dr. Emily is going to speak to a little bit more as we get into some of our common pathologies. So some common misconceptions. I think certainly it will get better with rest. I hear that often. Or I'll just stop doing certain activities. I think understanding that this is a mechanical problem, which is ultimately causing the symptoms. So if we stop or we just give it rest, the symptoms may improve, right? But the mechanical issue is still there. So to kind of put this in a little bit different terminology, if you think about a leaky pipe under your sink, if you have the crack in the pipe, that might be the mechanical problem. The symptoms may be the water all over your floor. Certainly there are things that you can do to address the water on the floor. Maybe that's put a bucket under the water or under the pipe, or just tape up the pipe, which will help to reduce some of that water over time on the floor. However, we're still not addressing the mechanical problem. And then to take that to the next fold, what typically happens when you have a leaky pipe at home? Well, if you've ever dealt with a leaky pipe, you know that they typically just get worse over time. So it's certainly something that you want to make sure that you're addressing and ultimately not ignoring. Another common misconception is I just need some pain medication, right? So yeah, that pain medication may give you some relief of those symptoms, but again, we're not addressing the mechanical issue. Or I need surgery. And that may be the case, in some instances that people do require surgery. However, we know from our experience and from the research that the prevalence of successful surgeries is ultimately low. It's somewhere between 20 to 30%. So ultimately, we would like to provide more conservative treatment to start off with and see how you respond from there. And then if surgery is really the last resort we look to. Or it will never get better. And we're here to tell you today that certainly things can be improved. You may not be 100%, but there's certainly things that you can do, actionable steps that you can take to reduce your pain and to put you in a better situation.
Yeah.
So as we get into some common pathologies, or better term, some common causes, right? So we talked about the mechanical issues. So we're going to kind of outline here some of those mechanical issues. I don't want you guys to get overwhelmed by some of these pictures here, but we thought it would be good to give you guys a visual to take a look at these pictures to get a better understanding kind of what it looks like. Just myself, I'm a very visual person, so I can appreciate these pictures and images. But here on the left, we'll see, this is a view of your spine from the side, looking at your discs, and it kind of gives you a look, understanding of what a normal disc would look like, a degenerative disc, and then also a bulging and a herniated disc. And then looking at the picture on the right, this is just an overhead view looking down at the disc. And on the left side is that normal disc, on the right side is a herniated disc. So just looking at that normal disc, if we're looking at it, just give you an understanding of what the disc's actually made up of. So mostly made up of water, right? So we have, most of this is kind of saturated with water. Inside we have the nucleus, or the jelly and the jelly donut, if you ever heard that analogy. And then around that nucleus is the walls of the disc, which really provide the support and stability. Problem is, over time, sitting, compressive loads on the back, you'll get wearing down of those walls of the disc, and which can lead to that bulging disc or that herniated disc, causing compression on the nerve root. Now, the big takeaway with this is ultimately, guys, that we can address this and we can improve this through treatment, through exercise. So you don't want to, I think a lot of times patients understand they have a bulging disc or herniated disc, and they just think that this disc is going to be bulged or herniated forever, and that's not the case. These things can heal up, the disc can scar up, and there is light at the end of the tunnel, so to say.
There you go.
All right, so next getting into spinal stenosis. Ultimately, this is like arthritis of your spine. So if you're familiar with arthritis in other parts of your bodies, you typically get narrowing down in the joint space just from years of compressive loads. Similar with the bulging disc, you'll get compression on the disc where that disc material can then press out onto those nerve roots and cause irritation and cause some of those symptoms down the leg. But again, there are things that we can do to help to address this, right? We can work on trying to open up that joint space, specifically with our hands-on treatment techniques, where we can open up the joint space, reduce some of the compression on the loads, allow those discs to be resaturated and renourished with fluid, and to relieve some of that compression, and ultimately to then build some strength and stability so that maybe our poor posturing or our poor mechanics that are ultimately led us to this issue are improved and not so much of a problem going forward.
All right, so one area that people commonly talk about when they talk about low back pain is, I hear them come in and say, oh, my SI joint is out of whack. So I just wanted to give you a picture today of where that is and what it is. So it's really the space where your sacrum and your pelvis kind of meet, and you can see that in that red square on the left. And it's really a place that's hard to diagnose because, unlike a disc and things, it's not found on an MRI. So this is really where, when Dr. Ken talked about hands-on treatment, this is where physical therapists can really specialize in helping to diagnose this area of your pain, because we really get our hands in there and feel what's happening. Most commonly, people are kind of limited by prolonged sitting or standing. Maybe it gets worse with things like repetitive movement, like lunges, running, walking stairs, things where your legs are split apart. And a big one that I see, especially with women, is they tend to have this pain during their menstruation cycle because of the cyclical relaxation that happens in the ligaments, as well as during pregnancy when everything's trying to move and open up for the baby to come out.
Excuse me, we got.
And one thing I'll say about the SI joint is that where the pain can kind of radiate to can look a lot like sciatic pain. So this one is really kind of, it can be easily misdiagnosed because of its symptoms that are similar to other pathologies. And the thing that Dr. Ken talked about before when we talked about sexual function and bowel function, a lot of times this kind of issue can be related to where the pelvic floor interacts with the low back. So the pelvic floor is actually 3 layers of muscles in your groin that hold everything up inside, and they attach both the front and side bones of your pelvis and back at your coccyx. So if you look at the right picture, there's a male and female there. The red thing that's kind of like a hammock are those muscles. And you can see where the rectum comes through that back squiggly gray piece. And so if you're having constipation, this can really push on the low back from where it's relative to the spine and also through that pelvic floor. And then also if you're having pelvic floor tightness, it can really tighten down on that sacrum and kind of pull in that area as well. So we see a lot of low back that's related to pelvic floor dysfunction.
All right, so ultimately we're going to talk about the solutions. So, from our perspective, what we're looking to do is help to mobilize or to stretch out the area. So we want to facilitate movement. We want to encourage movement. Strengthen the areas around, maybe there's some instability or some weakness resulting in those poor postures, those poor mechanics with lifting. So we want to strengthen the muscles, help provide more support. And then ultimately restore function. So we want to get you back to doing the things that you love doing. And we need to train you certainly in a functional way to get you back to those things. So it's not just, stretch on the table or some light activities and you're going to get there. It's like we need to take the next step to get you back to functional training as well. And then most importantly is our hands-on treatment. So that's a big part of what we do. As I was talking with some of our other pathologies, to help kind of open up those joint spaces, help to address the mobilization, help to facilitate muscle engagement to build strength, so that we can then ultimately get to that final step of restoring function and get you back to the things that you enjoy doing.
Yeah. One thing I'll just add on that slide, Ken, for people is just for people to realize that once you get through that mobilization phase with that hands-on treatment and working into those other areas, you're likely to have less pain. And so oftentimes in therapy, we find people stop coming because they're feeling better, but then you're not getting to those last phases where we really restore that function and you being able to go through the things that you want to do with less pain. And ultimately then if you don't make it to that level, you end up coming back with pain again. So it's really imperative to stay through your entire plan of care with someone to get you to that optimal level that's pain-free, to make sure that you don't have to come back with the same symptoms.
100%. So again, as we said earlier, we want to make sure that we're addressing the mechanical issue all the way through rather than just addressing the symptoms.
Right.
And get you that final stage so that you don't have to continuously come and see us or seek someone else's services, that you can be kind of self-dependent, if you will, and or independent, and make your way through it for sure.
So we're going to kind of walk everyone through just really kind of a baseline foundation of how we would go about back pain for the majority of the population. And again, we don't know each and every one of your issues specifically. So these are where it's a safe place to start for everyone, so to speak. And again, these are kind of the foundation of rehab. So they really just set the groundwork for what we would then advance to. So the first one we're going to talk about is diaphragmatic breathing. I'm sure a lot of you have heard about this, the belly breath, right? So I'm going to just show you an example of how to do it properly. This is in standing. You can do it in sitting. The easiest is doing it lying down. So if you place one hand on your chest and one hand on your tummy, you're hoping to feel the breath through your tummy, not your hand. Here's a bad breath up in my chest. And you can even give yourself a little press in the belly to give your feedback on where that breath should extend into. You can also place your hands on the low ribs. Again, I like to give myself a little bit of a stretch reflex, pushing in as I inhale so I breathe into my hands. And again, the best place to do this would be laying down to start, just to really feel that movement. And what we want to feel here is also a stretch into that low back. So a lot of times with back pain, we've kind of like stopped moving, and the breath can actually be like an internal self-massage, so to speak. We also know that diaphragmatic breathing can really help to calm down the nervous system. And since a lot of times in the low back, we're dealing with nervous system issues, it can just really be a good therapeutic exercise to basically start with, to calm everything down, to prepare you for higher level movement.
For sure. And to follow up on that, We're going to be taking a look at our next exercise, which is a pelvic tilt. And I'm going to highlight this in two different positions. So you can be laying down or you can be standing. Ultimately, it depends on what level is most comfortable for you and what level you feel like you can get the best engagement with. And once you feel like you can get that engagement in one position, we encourage you to try it in alternate positions as well. Ultimately, you want to just have that connection between the brain and the muscles and be able to understand how to engage those muscles. And as Dr. Amelia mentioned earlier, this is really our foundational exercise, a foundational step that we need to really be able to kind of progress from there into our higher level functional activities as we kind of spoke of earlier. So to start, we're going to show you this one where I am, there we are, laying down on the table. Pelvic tilt is basically you're just working on getting that back moving. So we're trying to get the back and the spine moving by engaging our muscles. We start by drawing the back up or the spine up off the table, and we'll re-show that to you again. So you can see my back kind of arching up, holding for several seconds, and then flattening down, engaging my lower abdominals here, my transverse abdominals to create those movements. So it's, again, it's a subtle arch up and then a flatten. And we'll be able to look at that a little bit more in our standing pick as well. So again, you can see that I'm positioned now up against the wall. Hands are on my hips. That will kind of give you a good indication of how my pelvis is moving and my back is moving. You can see my pelvis rocks forward here, and then my pelvis rocks back to flatten against the wall. Again, just kind of taking a look at that. So engaging the same muscles, we're engaging our lower back muscles as the pelvis comes forward, and then engaging those lower abdominals as the pelvis flattens and draws back into the wall.
And I think one thing to note with these is sometimes you have to start out very small movement just to get your body used to moving again. So if it's painful, back off a little bit and then work gently into more motion as you kind of progress.
For sure. Another thing I didn't mention is, be conscious of the movement that's occurring, right? So where in the video you can see my back was arching, my abdominals are flattening. You didn't see my hips lifting and raising up off the table. We're not trying to do a full bridge here. So a lot of times I'll have patients just initiate this, and it may look easy in the video, but when I have patients try to do this, you see everything else moving but what we're trying to do. Or people are gasping in and holding their breath, which is not what we're trying to achieve. So really important, I think, even though this looks easy, give it a try on your own, see how it feels, and make sure you're engaging those muscles the proper way for sure. All right, so moving to our next one here. So we're looking at a glute set. So glute set, another exercise, common exercise that you might have already done in the past. When you think about it in the sense of what it is, it's pretty simple, or it sounds pretty simple at least, where you're just basically squeezing your glutes and tightening up your butt in the simplest fashion I can put it to get those glutes to fire. But this is another one where I'll have people lay down on the table. I'll have them tighten up their glutes, do a glute set, and you'll see everything moving but the glutes. So the hamstrings are engaging, your lower back muscles are tightening up. So people just have a really difficult time isolating this muscle. So an easier way to kind of isolate that muscle is just by placing your hands under your hips or under your buttock. And you can do that right now while you're sitting in the chair. Literally just kind of take your hands, put them under your butt. You're going to just try and tighten up one side at a time. Okay, and you should feel that muscle raise up on top of your hands, and then slowly relax, and then alternate to the other side. When you're doing this, you also want to kind of check with yourself what's actually tightening up. Do you feel like your entire leg is tightening up? Do you feel like your entire body is clenching? If that's the case, then we want to try to reduce that and just really isolate the muscle. And the way to better do that is just kind of come on with the contraction nice and slow. If you start to feel other parts of your body start to tighten up, then just kind of lighten up on the contraction a little bit more, and then try to hold it. And then really trying to repeat this until you feel like you have good contraction of those glutes. Once you feel like you're getting the glutes firing pretty efficiently and effectively, we can then try to progress it into doing both sides at the same time. And that will really help to get those glutes muscling. So when we're trying to do those functional activities, like, we talk about our lifts, or we talk about squats, we'll have those muscles more primed and ready to go so that they can fire and help to facilitate these movements versus the compensatory movements that we usually do, which is engaging with our lower back or overuse of the other parts of our leg. So we really appreciate all you guys attending here today. as a show of our appreciation, we want to offer all you guys a complimentary consultation, which is a great opportunity to schedule time with Dr. Emily or myself, where we can sit down, discuss your specific problems that you might be having, kind of outline what we can do to really kind of help you through that and to reach the goals that you want to reach. In addition to that, we're going to offer everybody a free copy of my ebook, How to Resolve Back Pain and Sciatica Now. And so what I'll do is we'll send all that to you guys in a PDF format and through the emails that you guys use to sign up through the workshop for. So I hope you take a look at that information. I hope that can be really beneficial and useful for you as well.
Yeah, thank you so much.